For Crema Media's Polity, I'm Sane Dhlamini. South African Federation for Mental Health Deputy Director Leon Dibier discusses the state of mental health in South Africa. Welcome, Mr. Dibier.
Hi there, thank you for having
Can
me.
you please unpack for us what your organization, the South African Federation for Mental Health, does in the country?
Sure. We are the largest mental health organization in South Africa. We're an NGO. I'm from the national office that is based in Randburg, and we have 17 mental health societies located in provinces in all 9 provinces and communities across the country, and we have over 100 member organizations. So we have quite a big footprint across South Africa, and we're not a clinical organization. We're an advocacy body looking at human rights awareness. We conduct research and those kinds of things.
I'm sure for your organization, the recent report that was titled 94 Silent Deaths and Still Counting, that was released by the Health Ombudsman Malekgapuru Makgoba, must have been painful reading. Can you share your reaction after you received the report?
Yeah, sure. I think obviously the most painful thing was reading about the suffering and the hardship that was inflicted on the mental health care users and the families. But the frustrating thing for us as an organization is we saw this coming for a long time. We were one of the organizations who were advocating very strongly against this, and we tried our level best to reason with the Gauteng Department of Health together with our partners Section 27 and SADAG. And it was it's just very sad that it had to come to this when the warning signs were there, and we cautioned government against this because this was what was going to happen, and unfortunately it did happen.
And what is your comment on the way that this matter has been handled?
Handled by whom?
By government.
Well, I think the fact that we're sitting with a situation where so many people have lost their lives, and there's still X amount of unclaimed bodies in morgues, and families are still not able to find their family members. I mean, it's disgraceful. It really is a sad state of affairs when we have a national mental health policy framework that should be guiding these kinds of processes. And unfortunately, in this case, it's shown us what happens when those policies aren't taken to heart. It's one thing to have a lovely policy that sits on a shelf gathering dust, but when we don't do what it stipulates, these tragedies unfold, unfortunately.
Can you share with us the recommendations that your organization has suggested since this health report was released to the public, and how are you going to make sure that your recommendations are implemented?
I mean, we haven't made our own recommendations. We've supported essentially what the Health Ombudsman, he's made some excellent, very powerful and great recommendations. So I guess we've been working with the National Department of Health and a whole range of other partners now to try and make sure that the recommendations, again, are taken to heart and are fully implemented as per the Ombuds report. We were very, very happy with the Ombudsman's report, as it cut straight to the issue, and it really exposed the whole fiasco for what it was. So at the moment, I think our role is just to continue advocating and to make sure that these kind of things don't happen again. What this situation has shown us is what a lack of community-based mental health services there are, or that intense resourcing of those community-based services are necessary. So our role is just to continue advocating to try and make sure that what happened with life at Dhlamini and Gauteng doesn't happen anywhere else.
There are cases where families don't want to take care of their mental health patients, and we know of cases where they don't even visit them in the facilities. So how rife is this tendency in our country, and how can we better educate our society moving forward?
The unfortunate thing is that in the world of mental health, not just in South Africa but internationally, stigma and discrimination against persons with mental disorders or mental disabilities it's a widespread phenomenon, and sadly research has shown that the effects of negative perceptions and stigma and discrimination can be just as bad or even worse than the actual symptoms of a mental illness. So people face compound marginalization and discrimination. And I think the work for organizations such as ourselves is just to continue raising awareness and making people aware of the rights of persons with not just mental disabilities but all disabilities, to make sure that their rights, as are enshrined in the Constitution, the Bill of Rights, and all the relevant legislation, that those rights are realized, because persons with disabilities have just as many rights as everybody else, and are able to contribute towards society like everybody else.
And do you think that there is a way that the Gauteng Health Department, as well as the former health MEC Qedani Mahlangu, can better be held to account for what happened?
I'm not really in a position to comment on the disciplinary processes or anything that's unfolding within government. However, I think it's, again, I would just say that it's really sad that despite our best efforts to try and raise awareness about the issue that was going to unfold, it's just unfortunate that it fell on deaf ears and that we're sitting in a position now where people need to be held accountable, and the whole, so I guess that's our perspective really on that.
There are some patients who are now still kept in those unregistered facilities.
Yes.
How can this be resolved now moving forward?
So the National Department of Health, following the Ombudsman's report, the National Department of Health commissioned a process to go and look at all the NGOs and to assess, where people need to be moved. I was part of one of the task teams, and I believe that there's now a very detailed action plan going forward, where they're mapping out which people need to be moved where, and so there's a big process underway. That is, the National Department of Health, but in partnership with organizations such as ourselves and various other health professionals.
There was a very interesting statement in your website that was issued last year in December 3 on the International Day of Disability, where you said that you were calling for a commitment from government for mental health care.
Yeah.
What is the current state of mental care in South Africa?
Unfortunately, mental health care receives a disproportionately small portion of the health budget, despite the fact that 1 in 4 persons, 1 in 4 South Africans will at some point in their lives experience a mental disorder or a mental illness. So you're talking about 25% of the population who might encounter a mental illness at some point in their lives, which is a very big portion of our society. So unfortunately, mental health resources are not adequately resourced. Mental health services, are not adequately resourced. And there needs to be a more serious commitment from government to develop mental health services at all levels, from primary health care, community-based services, but also the services that are available in hospitals, tertiary care, to make sure that we can provide South Africans with a comprehensive mental health care system that can speak to all levels of need out there.
Someone who might be watching this interview might want maybe to speak to one of your workers,
Sure.
needing more information on maybe how to report something that they see in our communities. How can they contact your organization?
The easiest is just to give us a call on 011-781-1852. Or contact us through our website. We have one of our programs at the national office where I'm based is a human rights violations reporting system, where where people are able to report incidents of human rights violations to us, and we then work with legal partners to try and resolve those issues. So people can get in contact with us and we can take it from there.
Thank you very much for your time.
Thank you for having me.
That was SA Federation for Mental Health Deputy Director Leon de Beer speaking to Crema Media's Polity about the state of mental health in the country.